introduced your own healthcare plan, rolled it out this morning, that calls for creating a public option under the Affordable Care Act. Tell us why that is better than the Medicare for All idea that some of your opponents have suggested.
Well, I have great respect for my opponents, and I think their heart is in the right place, and I know they feel as deeply about it as all of you do and I do about making sure there's health care is right in America and adequate and decent health care is right. But it seems to me that having been part of this effort for a long, long time, it took a long time. It took 7 presidents to get to the point where we even could get the Affordable Care Act passed. And initially when we tried to pass it, we had a public option as part of it. That was what our team thought we would do. And we couldn't get that done. Now, it put about 100 million people with pre-existing conditions got coverage. 20 million people who didn't have insurance at all got coverage. You're able to keep your kids on your health care plan till age 26, et cetera. A lot of very positive things about it. And along came Trump. Yeah, it sounds funny, doesn't it? But it is. Along came Trump. And he decided to get rid of the Affordable Care Act. And he's tried to emasculate it, including going to court to, in fact, have it ruled unconstitutional. Now, the court's already ruled twice saying it's constitutional, so it's going to be interesting to see what they do now. But so it's the best what I would do immediately is restore all the cuts that have been made and then provide a public option. Let me explain how the public option works. How many of you have, when you were working, liked your, and you may still be working, many of you, how many of you like your employer-based health care? Did you think it was adequate? Now, if I come along and say, finish, you can't have it anymore. Well, that's what Medicare for All does. You cannot have it, period. Number one. There's a hiatus spot in between, by the way, how long it's going to take. So I give people the option. If you like your health care plan, your employer-based plan, you can keep it. If, in fact, you have private insurance, you can keep it. If you have no insurance at all, you are in the exchange, or in fact, you can buy into the Medicare-like exchange. That is the add-on to Obamacare. And so what it would do, it would cost about, to get to the end, because I always like to know how much things are going to cost, it would cost about $750 billion over 10. Not $3 trillion, but $750 billion. It would get 99.9% coverage. Anyone who had anyone eligible for Medicaid would automatically be enrolled in this option for no cost in the exchange. And everyone's numbers would be reduced in terms of cost to get into the exchange, to get as many people in as possible. That's where the number we get to about $750 billion over time. And so it seems to me that it does 3 things. And I'm not being critical of my opponents, so I'm not in the game. It's about what I'm for, not what they're for. And so I'm not into the game of, because that'll just elect Donald Trump if we get into that. But our differences are, I think the transition from having roughly 60 million people counting people with disabilities on Medicare now, to add another roughly 300 million people in one fell swoop. Understand, you understand this a bit better than most than I do, Medicare goes away as you know it. All the Medicare you have is gone. It's a new Medicare system. Now, it may be as good, you may like it as well, it may or may not, but the transition of dropping 300 million people on a new plan, a totally new, is I think, kind of a little risky at this point. And all of you, how many of you have lost husband, wife, son, daughter to cancer? Raise your hand. How many of us have terminal diseases? Raise your hand, I lost them. Well, you know, the thing I've learned is every second counts. It's not about a year, it's about the day, the week, the month, the next 6 months. It's about hope. And if you have these hiatuses, this may go as smooth as my grandpapa used to say, smooth as silk. But the truth of the matter is, it's likely to be a bumpy ride getting to where we're going. Even the people who have disagreed with my plan say, well, we're going to have to transition 3, 4, 5 years to get there. So I think you get your choice, you get full coverage, and you can stay with your plan if you like it, You can stay with your employer-based plan, or you can move on. I think it's the quickest, most reasonable, rational, and best way to get to universal coverage.
Should you